What's good with ya? What they do, YouTube? What's good with you, baby boy? Baby girl? How you doing? How y'all doing, YouTube? What's good with y'all, Facebook? Come on in. Facebook family and friends, come on in. How y'all feel this morning? Y'all know I was rushing trying to get here, right? Y'all gotta know. Do y'all be feeling my spirit in the morning when I'm rushing, trying to just take my time, but at the same time, I'm in a rush to get here, right? And it was like 8:43 this morning when my eyes popped open. Boop. I'm like, man, I might as well start getting on up, getting ready, getting prepared, getting my thoughts in order. You heard I said my thoughts. Get my thoughts in order. You feel me? How y'all feel this morning? Y'all good? Y'all come on through the set. I'm giving y'all some time to wake all the way up. Get your mind right. Get your thoughts prepared. Get your understanding understood. You know what I'm talking about? Because y'all know what's understood don't need no explanation. You know what I'm saying? I said what's understood do not need an explanation. Ooh-wee. And so we're going to get understanding up and through here. You know what I'm saying? We're going to get some cognitive ability. We're going to get our mindsets right and shifting in the appropriate order. You know what I'm saying? We're going to line some stuff up. We might have to even stretch our minds, because you know that once your mind is stretched past the original elasticity part, right? Once you are stretched past that point through knowledge, through information, through understanding, through comprehensions, through ideologies, through narratives, however it's going to get stretched, right? Once that mind has been stretched past the point by which it once was, guess what I'm discovering? It cannot even snap back into the dimension by which it was prior to the new understanding and the new thought process. It can't even snap back through. And so we're going to ask the universe for more, please. More, please. More. Give us more. Give us more comprehensions. Give us more ability. Give us more agility. Give us more opportunity. Give us more advancements. Give us more. We need more. That's a good word this morning. Give us more. More of the positive things in the hourglass. More of life. More of light. More of consciousness. More value. More worth in the earth. You feel me? Give us more. That's what we need this morning. Give us more. More, please. More. Give us more. As we listen to this music that's designed specifically to open our and align our chakras, to give us the opportunity that we need to go further. And so we gonna go further. We might as well. Ain't no reason not to, you feel me? Ain't no reason not to go further. Why you want to be stagnated where you at? Why? Tell me why. I know it's comfortable there. I know it's a certain level of comfort that you can be in when you're familiar with this familiar territory. But here on this hourglass era by which we live, we're going to have to stretch our minds past the narratives by which we were once given. Ooh-wee. And if that's not your desire, ma'am, hey, ma'am, sir, if that's not your desire to not go past the point by which you once was, you remember the universe told us at one time, he said, stretch me past the point by which you feel as though you can do it for yourself. Ooh-wee. And so once you start stretching, once you start aligning, once you start balancing, and once you start getting your mind in order to prepare for the new growth and for the new extinction, you feel me? We going to the extinction. Hey, we gotta be extinction. We gonna be extended in here. Hey, look, if you expect to be the same, you might well don't even come this way. Did you hear me? If you expect to be the same, right? If you're expecting to be the same, if you're expecting to stay the same, I think you might be in the wrong podcast. I believe that you might just be in the wrong podcast. And you keep on flipping through the podcasts, I'm guaranteeing you'll find one that, align with you. But if here in the hourglass era by which we live, we're going to have to be cognitively aware of the pH in our bodies and all three components. Not just the pH in your body, man, but the pH in your mind and the pH in your spirit. You feel me? All three of those are three separate entities. They're three separate compartments, but yet and still they're the same. So I'm sitting here sipping on my pineapple juice this morning. I needed something to kind of like soothe my fifth chakra, in order for my situation to start preparing. And I sat back for a second, right? And I sat back for a second, right? Before I even did this here, I sat back for a second. And I started thinking about some things, right? And I'm saying, you know what? Somehow or another, we're gonna have to allow ourselves some opportunity, right? We're gonna have to allow ourselves an opportunity to advance, because we can't stay here in the same point by which we were in the beginning of the year, in 2024. In the beginning of this year, how are we going to still be in the same place 6-7 months later? I'm waiting. We're not going to have the ability to stand in the same location and use the same keys, because the keys that once unlocked doors in 2019 and 2018, prior to that pandemic coming through, right? I'm telling you right now, those keys might not work in the locks of the new locks of this new age understanding and comprehension. And so we're going to have to shift. There's a shift that's going to have to happen, right? And so yesterday or day before yesterday, I think it was Friday, as I was moving around after the live on Friday, right? Because I know I came in and dropped some jewels on Friday. And so at the same time, as I was moving around and taking care of my business and doing the things that I know I needed to do, right? The universe said this to me. He said, it's time to put your scrubs back on. Ooh-wee. Just like that. He said, it's time to put the scrubs back on, right? So I'm like, the scrubs? And I was like, okay. And so I remembered that last night when I got home and I came and dug all my scrubs out the bottom of the drawer, right? Got to my ironing board and I started ironing scrubs for the week. I said, it's time to put the scrubs back on. So I ironed this blue one and the gray one and the green one and the white one. I got several scrubs that I go to into a certain area of the hospital. We all normally wear scrubs, right? Y'all know that. Y'all know in the hospitals, we normally wear scrubs in the hospital. Oh, you think y'all think they doctors and they really environmental workers. Everybody got to have a scrub on in the hospital. No matter what you do, you could be an environmental worker taking out the garbage, taking out all the plastic bags out of the garbage, and you're going to have your scrubs on. You feel me? And so the hospital is symbolic of scrubs, right? And so he said, no, you got to go deeper than just that point. He say, no, you got to go deeper than that. He say, tell him I said to put the scrubs on. I was like, wait a minute. So y'all know, I remember that when something, let me tell you something, when the creator of all things speak to your spirit, I say when the creator of all things speak to you, and he's moving you into a different direction by which you don't know where he's leading you, right? And it's I think at this moment in time, at 57, I don't even care. I don't care to the point by which I'm being led, as long as I'm being led by the creator of all things. I don't even care about that. Because as long as I know that he has my best interest, or she has my best interest, or it has my best interest at heart, I'm talking about the creator of all things, then I can be led. I know that his words will continue to be a lamp upon my feet and a light upon my pathway, right? He'll lead and guide us into the direction by which he wants us to go. We don't even have to listen. All I feel like I am right now is a puppet. And I'll allow him to be the puppet master. He can guide me, order my steps, and order me in the directions by which he feels as though I need to go as I became and as I become and as I create the understanding and the comprehensions of the thought-provoking specialist, right? Because I am the thought-provoking. I am Kendrick B. Davis Sr. I am your thought-provoking specialist. I'm your health conscious coach and your intellectual content creator. I'm also your podcast professor. And so at the same time, when he told me that the other day, about 3 or 4 days ago, weekend before last, he said, put the scrubs back on, right? So I'm like, man, okay. So I remember that 3, 4, 5 days ago. And I remember that. And I came in last night obedient to what he has spoke to my spirit. And he said, tell them to put the scrubs of life back on. I'm here to tell somebody on the sound of my voice that you might not have the ability to stand outside of the rooms of life, right? And just be normal. You might not have the ability to do that. I'm telling you, there's going to come a time in your life like how it came a time in mine, man. Hey, sir, I'm here to tell you and pre-warn you that there's going to become a time in your life when you're going to have to put the scrubs on. I'm telling you that. You're going to have to scrub in, right? And so right now, as I prepared this morning, as I saw this morning, I looked at some things right quick. I woke up in the middle of the night. I slept through the night real good, but I did wake up in the middle of the night, and maybe it was him or her or it waking me up, right? To give me this assignment. You know just as well as I do that you're going to have to scrub in, sir. You're going to have to stretch your mind beyond the point by once was comfortable back in the day. You know what I'm saying? You're going to have to stretch your mind past that point. And so, the process of stretching, right? And the process of stretching the mind is the process of teaching the brain a new way of thinking. And I'm telling you right now that at certain times in our lives that we're going to have to teach our brains a new way of thought, of thinking. You're going to think a thought that then you're going to be unthunk it. You know what I'm saying? No, I'm just playing. You're going to thunk thoughts that you need to think. You feel me? You're going to think thoughts that you need to thunk. You feel me? It's all good. Think the thought that you thunk, think, and think the thought that you thought. Oh, I'm sorry. You asked me to say that again. I couldn't even do it. I couldn't do it again. I'm sorry. But yeah, we're going to have to stretch our minds, right? And this process of thinking, the brain, or teaching the brain a new way of thinking. And in doing so, is what is going to happen is going to connect that left hemisphere with the right hemisphere. And once that interconnectivity happens in your mind and in your thoughts and in your brain, your physical brain is connected from the analytical side on the left side of your brain to the artistic side, which is the right side of your brain, right? And so we're going to have those interchangeably, popping from side to side, left hemisphere, right hemisphere, left hemisphere. And we're going to have to go back and forth in the intertwinement of our thoughts. On one side is analytical, and on the other side is artistic, our creative ability, our innovative abilities to do whatever it is that he has called us. And all of us have this concept. And so we're just here this morning. As I told you, we're going to eventually have to scrub in. And so in my mind and in my thoughts, he took me back to the days when I was working on my AS degree in radiology. And at the same time, in 1996, I started school, right? And I did all my prerequisite at Miami-Dade on 27th Avenue and 119th. And so I did all my prerequisites there. And then for the last semester, right before I was getting ready to get accepted into the program, I went out to Miami-Dade, the medical center campus. And so 1997, I was the only Black American male at Miami-Dade. We had some Haitian brothers, and we had a dark-skinned Cuban brother, but I'm saying the Black American. I'm the only Black American male in this class, Miss Goodall. And Miss Goodall was our professor. And she was telling us the whole thing that, listen, if you get caught with a job, a full-time job in X-ray school, they kick you out the school because they already know you cannot do a full-time job as well as do a full-time schooling in X-ray school. So everybody had to hide and duck and dodge on things that they had to do outside, because they get caught with a full-time job, you getting kicked out of the X-ray program. This was in 1997. And I eventually graduated in 1999. But while I was there, right, while I was in school, I was a student. I think I was going into the end of my first year, going into my second year of radiology technology school at Miami-Dade, the medical center campus on 20th Street and 10th Avenue. And so as a student, I remember going into the OR for the first time. Woo-wee. And let me tell y'all something now. Y'all, have any one of y'all ever been, I need medical professors or medical professionals around me right now that has literally worked in the OR. They can tell you some stories, ma'am. Hey, sir, I have a story to tell. I can tell you this as a student, as a first year, going into my first year. I think it was my end of my first year, because they already gave me an X-ray, and they already gave me an X-ray room that didn't have fluoro in it, because they wanted to see, did you know all your positions, and did you know all of your cassettes? We call them cassettes that you slide into the X-ray machine, and you pull it out. You take the X-ray, and different cassettes made for different sizes and different, body parts. So you got an elbow, it's a smaller cassette. If you got a knee, it's a bigger cassette. It's the long way. It's a short way. It's different, all kind of ways of how they put the cassettes in, right? And so at the same time, as I was matriculating through this school, I remember going into the OR for the very first time. Because as students, we had to go through every department. We went to the ER, we went to the OR, we went to specials, we did IVPs, we did barium enemas, we did Instagram. I mean, it was so many things that we had to do, you feel me, in order to make it through the process of this schooling, to verify if you had the ability to do a C-spine where a person couldn't move their neck, and you know what I'm saying, and it wasn't in the X-ray room. So we had to do the C-spines on the cart. Place the cassette on the side of the person's neck. Don't move their neck. Put the cassette. Make sure that we angle properly with the machine and get the X-ray done, right? For the radiologist to read it, to see if the person had a broken neck or fracture, or hairline fractures and things of that nature. And so while I was there, It was my turn to go into the OR. And I'm telling you right now, when you have to scrub in, and get all the dirt and the things out from under your nails, and you use a brush to scrub your, your hands and scrub all your, all the way down to this part right here. And I remember when it was a big faucet, right? It was a big faucet that actually sprung out hot water. And so when you scrub in, you scrub in from your fingertips down to your elbows. That's how you scrub in. You can't scrub in the normal way. You had to scrub in from your tips. So they gave you a brush with this little brown soap in it, and you going back and forth under your nails, up in your hands, down to and you lather your hands up real, real good between your fingers, and you rub and you scrubbing, right? It's like a little brush in this little scrubbing pat. It's like, I wish I had one right now. I wish I had a whole EOR scrubbing panel with everything, with the gloves and everything, so I could show y'all what we had to do in order to scrub in to prepare for the surgery, to prepare for the operating, the surgery. I'm telling you, in the OR, it's a whole nother process by which it was in the ER. The ER, the emergency room, is not as sanitary, I guess. It's still sanitary, but not as sanitary as the OR, because the OR we're getting ready to go deeper into the body in some shape, form, or fashion. I've seen a whole arm right here split from here to here, and it was in there drilling. The OR actually sounds like a auto body car part spot. That's what it sounds like in the OR. That's how it sounds in the OR. When you working on a body part, ma'am, when you're working on a body part, sir, whether it's that person's arm split from the wrist all the way down to the elbow, and all their flesh is opened up, and you see their radius and their ulna. The radius is always going to be stuck to the thumb. You know I could teach this stuff. Y'all know I could be y'all professor. Now don't get it twisted. Y'all know I'm the professor. I am Kendrick B. Davis Sr. I'm your thought provoker. I'm here for no other reason to provoke thought. Cause your mindset shift to know that you're not going to have the ability to stand out on the outskirts of life and act like you're going to get all the correct answers. I'm here this morning to tell you to scrub in. Ooh-wee. I'm here this morning to tell you you don't have the ability to peep in on the around the curtains of life and peep in on everybody else's assignment and act like your assignment is going to get done. I'm here to tell you that you might have to scrub in. Don't you see I got these scrubs on this morning? Y'all see I got these scrubs on this morning, because at the same time he said, tell them I said to scrub in. You're going to have to scrub in. You're going to have to get all all of the things that's up under your fingernails and all the skin, the extra skin. Scrub in the OR. You scrubbing in. Did you hear me? Scrubbing in the operating room is a procedure that involves washing your hands and your forearms, putting on sterile gowns and putting on sterile gloves to reduce the risk of contamination and infection during surgery. And I'm here to tell you this morning that you're not going to have the ability to come in off the street, right, without first having to scrub in and prepare your mind and your thoughts and your inclinations and your elevations and all of your escalations in the thought process of life. You're not going to have the ability to come into this room without first scrubbing in. Ooh-wee. You're going to have to scrub in, ma'am. Hey, sir, as we go into surgery, as we start preparing our minds for the OR, the operating room, you're going to have the ability to scrub all the way in. Scrub your thoughts. All the disgruntled thoughts that you once had, all of the lower vibrations of thought that you still have even right now, through the narratives and through the ideologies of all these different things that has left us down and led us down this road of narrow-mindedness, of narrow thoughts, of narrow, restricted mindsets that they don't want you to even understand who you are in the earth as a whole entity. They'll give you ideologies. They'll give you certain narratives that will lead you down to a lower vibrational state. When you are the I am in the earth, they'll lead you and say, no, reach outside of yourself for this entity. Reach outside of yourself for this superior being. When the superior being is already in you, I believe that it's the biggest misnomer ever. I believe it was just the biggest diversion ever, is to make a person feel like they got to reach out to this entity that's outside of themselves and make them believe, and you believe according to what's outside of you. When in essence, he's already in you. You just got to go inward to tap into the understanding and the comprehensions and the ideologies and the conscientiousness that's already there. I believe that they have fooled the mind of the people. But I ain't here for that. Because we all at one time or another had to have our aha moment. Did you hear me? I say we all at one time or another had to have our own individualized aha moment. So your moment came from different from mine. My moment is going to be different from yours. Just like how we came into this earth with a different month, day, and year. We all came in to this earth, to the diaspora, to the universe with a different month, a day, and a year. You came in with a zodiac sign. You came in with a blood type that now at this moment, I will not talk to anybody unless I know your blood type and you got to know your zodiac. Because every blood type has a generalized characteristic, and every blood and every zodiac has a generalized characteristic as to And so I'm here this morning to tell you, if you're going to come into this session, you're going to come into this understanding. If you're going to have to come in, you're going to have to scrub thoroughly your thoughts. Give yourself a clean slate. So when you come in, you're not coming in with all of the dirt and the filth and the bacteria and all the contaminations of the world, and bring it into a whole nother viewpoint by which you feel as though you're gonna go into the OR. Nah, I'm gonna stop you at the door. Hey. I'm going to stop you at the door based on the fact he told me it's time to put the scrubs back on. Ooh-wee. And so we're going to scrub. We're going to go deeper into the OR. You know you can't come, not one medical professional can come off the street with their natural street clothes on and come into the OR and act like they're going to go to surgery. It's some procedures that has to happen, man. Did you hear me? I said there are some procedures that has to happen. You heard what I said? Has to happen. You heard what I said? I ain't said. Hey, look, you heard what I said. There are some procedures, sir, that gonna have to happen prior to you stepping into the OR to help the surgeon get the job done. There are some procedures. And so at the same time, scrubbing in is the one of them. And when you scrub in the operating room, is a procedure that involves washing your hands. Don't come up and through here and act like you're going to have them old dud-ass hands. You feel me? You know what I'm saying? I said, don't come. You heard what I said. I said, don't come up and through here acting like you're going to have them old dud-ass hands. You feel? We got to talk some street stuff because I'm talking all nice. I'm telling y'all, we ain't getting nothing done. They got my algorithms all low out here in these streets based on the fact that I'm saying some stuff that's some good stuff. They don't want them algorithms to pop all the way off like that there. So I ain't never asked you Negroes to, come and like and share and subscribe. Y'all ain't ever heard me say that. Not one time. Go back to all my lives. I got over 130 some, 40 some sessions. Go back and look through every last one of them and see have I ever asked any one of y'all to like and share. Go and see. I ain't never asked y'all to like and share nothing, none of my stuff. You ain't got to. All I want you to do is open up your mind and understanding enough for me to drop these jewels in your tympanic membrane. Maybe it ain't meant for you at this moment to like, share, and subscribe. You ain't got to subscribe to my stuff. Keep on flipping. You're gonna find some stuff out here that's gonna entertain you a little bit more than what I will, because I'm coming with intellectual content. I am an intellectual content creator. I'm also your podcast professor. And then sometimes y'all don't want to be professed at. Hey, sometimes y'all don't want to be all professed all up. You feel me? So I understand that. Keep it moving. Move around. That's the new word. Move around in. You know what I'm saying? Go ahead and move around. Move around, sir. Hey, bro. Go ahead on and move around, my brother. It's okay to move around. You're going to find some data and some content out here. I like it too. I sit there and watch that dude put the Lambo on the side of the road. You heard me? I sit there and watch him too. Put the Lambo on the side of the road and then get out the car and walk down the sidewalk with this little baddie, little chick, walk through. Like, excuse me, can I, you know what I'm saying, say I have a few words? Like, nah, I ain't interested in you. Going on about your business. And he just, you like, damn, you ain't gonna give me no time of day? Oh, no, I ain't interested. I got a dude. You feel me? Then at the same time, he jump off the curb and say, derp, derp. He hit that derp, derp, derp. And at the same time, here she go looking at the car. Now he jump in the big Lambo. You feel me? The Lambo truck. And then she come running back. She make a beeline to the man, to the driver's side door, tapping on this man's glass, telling him something. I'm like, what happened? He gonna tell us what it is, what's going on. He cracked the window like, what's up? What's going on? Then you wasn't when you just trying to talk to me a few minutes ago. He's like, yeah, but you gave me some old badass energy. You feel me? I ain't like that energy you came with. He said, well, I didn't know you was driving this. He's like, what this got to do with with the energy that you had on that sidewalk right there? What this got to do with the energy that you just had? You just had energy against me seconds ago. What changed? Oh, I ain't know you were driving there. And not all the time. I don't want to tell y'all because I got some women on here. Y'all better be glad, y'all better be glad I got to put some constraints on. Hey, it gonna come a time when I be free enough to tell y'all how I really feel. You feel me? You know what I'm saying? Yeah, I'll be free enough in a few minutes, but right now I have to make sure that I'm entertaining, you know what I'm saying? I gotta entertain intellectual content. And I'm here to tell you that you might not have the ability to come off the street and come all up around me without scrubbing in first. There's some procedures that has to happen before you come off the street and then come straight into the OR. Because I'm telling you right now that at certain times of this thing and this podcast right here, we're going to have to take out our scalpel. We're going to have to get and bust it open. They bust the plastic the plant right in front of you. They open up all of the utensils that we got to use in the OR. They open them up. They like peel them back. It's like a plastic little piece that you peel back that have been sterilized. And you can't come off the street without your gloves on and then act like you're gonna just jump straight and you ain't wash your hand. Listen, we couldn't even do that at grandma them high. You know that. Grandma holding about to bust your whole head to the white meat with that ruler if you came in off the street and then didn't even wash your hands and try to put your hand on the top of the pot so you can look into the pot of the food that's being cooked. She'll bust your head to the white meat. You know that. Stop acting like you don't have to scrub in. Ooh-wee. Stop acting like you don't have the enough home training. Stop acting like you don't have enough etiquette. You know you can't come off the street into no stranger's house or into no person's house that you ain't even comfortable with and just open up their pots and start looking in it without washing your hands. You know you can't do that, ma'am. You know that person of that home will feel disrespected and tell, hey, get out my kitchen. You ain't even washed your hands yet. Stretch your mind, man. Stretch your thoughts. Get your mind in order and get ready for the procedures that has to happen prior to. Ooh-wee. I say, get your mind together and act like you better know, especially at 30, 40, and 50, and 60 years old. And you act like you don't have the ability to put and know the proper etiquette. When you first come into the house, you don't go straight to nobody's kitchen and start taking and digging out their pots and digging in your hands and you and looking at the what they call it, the casserole. Start looking all and peeling the aluminum foil off the casserole. Tells them, oh, let me see what's in here. They're gonna like, get your crazy stuff out this kitchen, boy. Get your crazy stuff out the kitchen, man. Hey, bro, get out the kitchen, man. Get out the kitchen until you do the necessary procedures in order to scrub in and prepare your thoughts and prepare your minds and put your gloves on. Put your mask on. Take down your trap down your hat. So at the same time, we put on in OR, everybody gotta have their head their little head thing tied and knot back there. Uh-huh. So I'm here this morning to tell you it's time. We don't have the ability, ma'am, to jump straight out the street and jump straight into the kitchen. And if you're a medical professional here, you know exactly that you cannot come out the street. I don't care how many times you don't wash your hands before you got to work. We need to see when you get in the work, you need to scrub in. We need to make sure that all the bacteria and all the contaminants that's under your fingernails and up around that you done touched all these doorknobs to get into work. You done touch your badge to give you accessibility in the hospital. You do not have the ability to jump straight out the street and then come in to the assignment without scrubbing in first. And so the universe 3-4 days ago told me to tell everybody under the sound of my voice, it's time to scrub in. Ooh-wee. He said, tell him I said to scrub in as we prepare to enter into the OR of life. We don't have the ability to stand outside of life and then peep in behind the curtain of life, watching everybody else do their thing. Because you're the only fingerprint in the earth that can do it your way. Ooh. He said, tell them I said to scrub in. And so y'all see this morning, I put my scrubs on this morning. Last night, I couldn't wait to get home. Because I promise you, this thing hit me so hard that I had to go and dig all my scrubs out of the bottom of the drawer. First one I put my hand on was the gray one. I said, I don't want to wear gray this morning. I want to have the blue on. He said, yeah, put the blue on. And make sure you put on the scrubs that you like. And so these are my scrubs, y'all. And so I'm here this morning to tell everybody on the sound of my voice, it's time to scrub in. And when you scrub in, you prepare yourself. It's a process that involves washing your hands. You know, we got a lot of that when the pandemic came through. When the pandemic came through, you know what I'm saying? Everybody all of a sudden got all sanitary. And I'm here to tell you that I was already that way prior to the pandemic. They missed the L between the P and the A, sir. Hey, cuzzo, they missed that L between the P and the A. It was a plandemic. It wasn't a pandemic. They planned that. There was a plandemic to get everybody on the procedure. And so we have to, it's a process that actually involves washing your hands and your forearm and putting on a sterile gown and putting on a sterile glove to reduce the risk of contamination and infections during surgery. And I'm here to tell you that sometimes in this thing called life, we're going to have to scrub in. And I wish I can show y'all the process by which we had to do it. Because we had to take out the suds, right? And it's like a little brush on one side, and on the other side it was like a little sponge. And we had to scrub all in between our fingernails, right? We had to scrub, and it lathers up real good. All between your hands and all between your fingers. You got to scrub, right? Scrub. And all between your arms. And you got to start from your tips of your fingers and go all the way down to your elbow. And all this is full of suds. All the whole elbow. And when you rinse off, you better not let me see you rinse off with your elbow down to your back of your fingers, or you're going to have to scrub in again, sir. You ain't even scrubbing. You ain't even scrubbing in right. Ooh-wee. I said you didn't even scrub in right. So re-scrub, soldier. Hey, bro, you got to re-scrub, man. I'm standing on the side of the sterile sink in this thing called life. And I'm going to sit there and I'm going to watch y'all and critique y'all as y'all come in and scrub in, preparing for the OR, preparing for surgery. In the OR, it's a procedure that has to happen before you can come in and act like you can assist anybody in the surgery. I don't care if you're an anesthesiologist. I don't care if you're the surgeon. I don't care if you're the x-ray tech, like how I was when I first seen open heart surgery. I almost fainted. I'm telling this in my book. I almost fainted when I seen that heart, when I looked down into the cavity of this person's chest, right? And I looked down into the cavity and seen that whole heart, boom, 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 with that tricuspid and bicuspid valve that opens and closes. You Google this for yourself. You ain't got to ask me no question. I ain't finna tell you no lie. I say, don't ask me no questions, and I won't tell you no lies. I promise you I won't tell y'all no lies. But there's a bicuspid and tricuspid valve. Google it. Bicuspid and tricuspid valve that open and closes, that give you the sound of boom, 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 boom. I looked down into this dude's chest as a student in the OR. When I seen his heart, they had them broke his sternum, and they had these two big clamps pulling his chest apart like that. I don't know if it's a man or a woman, to be honest with you, because they be so covered up. The only thing that you can see is that open part. You can't see that person's face. You can't see none of that. You can't see none of that as an x-ray tech. And I looked down into the chest to prepare the x-ray machine. to put the x-ray machine directly over the chest under fluoro is fluoroscopy. And so I had to guide the C-arm in order to put the fluoro right up over the chest. And when I looked down into the chest, I saw the heart. And my mouth went to water. My mouth just came with water. And I started perspiring. My hands got wet inside my gloves. Underneath my arms started to sweat. And I almost literally fainted in the OR. And I remember that I was with a surgeon that was a real a-hole. Y'all know that these surgeons can be, anybody that ever worked in the OR, these surgeons feel like they're God. I really believe that sometimes surgeons in the earth, that if you open up and you see, you know what I'm saying, like, you know, a cardio nurse or a cardiovascular doctor and surgeon, sometimes I believe that they hold life and death in their hands through the decision processes that they have to make instantly. While they got these people chest wide open, they have to make instant calls instantly. Their mind got to be on point to make instant calls right then, because these people's lives are literally hanging in the balance. They're literally hanging in the balance. Contamination, bacteria, infections are literally hanging in the balance. And one wrong move, one move too fast. And this surgeon that I was working with, he didn't want everybody to move fast because he felt like he'll stop the surgery right in front of everybody, snatch all the stuff off the people and make them redo it all over again. And I remember I was with this surgeon. He liked me and I liked him too. But at the same time, he's an old white gentleman. But, you know, he respected me and I respected him too, because he knew I was a student in the OR doing these type of assignments. But when I moved like a real professional. And he liked that. And I remember one day he called me over to the slide when I just had walked into this room, to the x-ray room. And he looked up and he looked at me. He said, "What do you see?" And it's about 3 or 4 more x-ray students that was standing around me, some of my peers. And they looked at me and they looked at me. I looked at them when I first came in the room, because all of them was standing around him in front of this big white glass with he had all these slides, these x-ray slides up. He had put one up. I didn't know this at that moment, but he had asked everybody else what did they see, and nobody saw anything. And so when he asked me when I first came in the room, he put me on spot in front of everybody. He said, "What do you see?" I stayed there for a second and looked thoroughly. And I'm here to tell somebody in life, you might have to look at this stuff thoroughly. You're not going to have the ability to glance past some of these things in life and then act like you're going to get the right assessment and the right evaluation based on the things that you saw or you see. Sometimes you might have to gaze, sir. Sometimes you might have to look deeper than the surface of it. And I looked at this x-ray. And I looked at that x-ray and I said, "I see a hairline fracture, sir." And he said, "What?" I said, "I see a hairline fracture." And he didn't believe what he's heard me say. And he gave me this little black little pencil that had the little thread where you could pull the little, like it was like the thread. You don't have to in this radiologist, that you don't have to sharpen it. It's like you could pull the thread and then the ink could be exposed. And so he pulled the thread back. He gave me this pencil and he said, "Circle it," trying to call me out in front of all the other students, my peers. And at the same time, I looked at that thing right then. I grabbed the pencil out of his hand and I looked extremely well. I'm going to tell y'all, sometimes in this thing called life, you're going to have to look extremely well. You're going to have to look past the overall big picture and narrow in to the point by which you see the hairline fracture. And I grabbed that pencil out of his hand And I just put a circle around the fracture. The hairline, it was so thin that the natural eye cannot even see. And when I circled that fracture, he looked back at all the other students and said, he's the only one that got it. Ooh-wee. And I'm here to tell you, sometimes in life, you might be the only one to get it. Did you hear me? I say sometimes in this thing called life, sir, you might be the only one that can see it your way. No one else will have the vision. No one else will have the viewpoint. No one else would have the perspective by which it's going to take you with your eyesight to see it. So I'm here this morning. I am Kendrick B. Davis Sr., your thought-provoking specialist. I'm your health-conscious coach and your intellectual content creator. I'm also your podcast professor. And I'm here this morning telling you, you might have to stretch your mind as you scrub in. It's multiple assignments upon our lives as we move forward in the cognitive, the ability, and the assessments and the evaluations and the ideologies that has to happen in order for us to be catapulted and propelled into a new dimension of thought. We're going to have to stretch our minds and scrub in. And so I'm here this morning as a stretch minder. I'm here this morning to stretch your mind beyond beyond the restrictions, the borders, the boundaries, and limitations by which I think this world and this world systems and this world society and societal norms and all these things that has limited our capacity and gave us other perspectives and other viewpoints by which they want us to see it from that perspective and keep us blinded from the perspective by which is going to give us the best results. So I'm here this morning to help you stretch your mind past the pains and the past pains of life that when you were touched inappropriately, or that when you were, taken advantage of as a child, or mistreated as an adult, or anything, all the, had an accident like myself and broke your right hip and put you in the hospital, even gave you the point by which x-rays became an interest for you. I didn't have x-rays on my mind until my hip was broken and my left ankle put me in a body cast for 9 months. Everybody know that I walk with a limp. And I'm here to tell somebody that I can lead with a limp. I don't have to walk. I'm sorry, y'all. Y'all got me stretching this morning. Did you hear me? I said, y'all got me stretching. And y'all got me stretching. Y'all know I want to do my glasses. I'm the one to do this. Hey, I'm the only one to do this right here. I do that all the time. I don't know why I crush my bottles like that. But y'all got me stretching this morning. And I'm stretching past the point by which I feel as though we're going to have to move. And we're going to have to reach beyond the breaks of life and hold on past the points by which we do not understand. And so maybe this is the point by which he told me on October 15th, 2022, he said, speak into the mind of the people. And maybe I'm here this morning to tell somebody, stretch your mind as you scrub in, As you prepare for the surgery, as we prepare to go deeper, as we prepare to put on these sterile gloves and these sterile gowns, and we're going to have to reduce the risk of contamination and infections during surgery. But there's a process that has to happen, sir. There's a process that has to happen, ma'am. Hey, bro, there's a process you're going to have to go through. There's certain procedures, sis, that you're going to have to endure prior to getting into the OR. You can't come straight off the street and act like you're finna go into surgery. You can't even do that as a patient or a healthcare provider. Both parties have to be scrubbed in. We even have to scrub in the individuals that's getting ready to have surgery and cut all the hair off their chest and prepare the skin and all the surrounding areas. We have to scrub those individuals in as well, the patients. But here we are the healthcare providers, and we have to scrub in too. From our fingertips all the way down to our elbows. And you bet not ever let me see you scrub in backwards from your elbows and let the water drain back. Like you done scrub your hands and wash your elbows and wash your feet. Wash your fingers and got all your stuff and then go all the way down. And if you don't do like this, if you don't take the water, you got to take the water and you got to scrub it from your fingertips and you got to go up like this. And let all the water drain down to your elbows. That's how you scrub in. And that from that point on, you never take that hand out the air, ma'am. Hey, sir, you never drop your hands back down to your sides ever. You got to scrub in from this way, and you take that hand and you scrub it in like this here, and you scrub all the way in, and you let all that water run all the way to your, and you walk around like this. This is how you walk around until your surgeon, until your assistant come and help you, because you need help. And they take the two gloves that they done already scrubbed in and prepared, and then they take your glove and then you put your glove in. You put your hand in the glove like that. Put this hand in the glove like this, and you keep your hands up like this. You don't touch anything else before you go and start grabbing onto those utensils that's in the OR. And I used to love the scrub in. I used to love it. It just makes you feel like everything gonna be all right, because you done made sure you got all the excess baggage and the excess contamination and the excess bacteria and the excess all these antigens that's in the air that would throw your surgery off. It'll throw your surgery off. If that person get infections after your surgery, then guess what? You did something wrong. If they have a surgery, they have a surgery, you better, hey, listen. Ooh-wee. I'm here to tell somebody it's time. We don't have the ability not to scrub in. Did you hear me? I say we don't have the ability not to scrub in properly. That's why he told me 3 days ago, he said, tell him I said to scrub in. Y'all see I came in this morning with my scrubs on. As I prepare, as I look forward, as I get all of the downloads and the understandings and the comprehensions in the earth, it's time to scrub in. You better not ever drop your hands again. You better let that water drain from your fingertips all the way down to your elbows, ma'am. You take that water and you just put your hands and you can't even touch the faucet. If you touch the faucet, by which if you touch that faucet, I'm gonna make you do it all over again. Because you scrubbed in, you contaminated yourself when you touch that faucet. You better not turn that water off. After you done scrubbed in, you better not touch that faucet and turn the handle. You better not touch it. You will get fired. Promise you. If you put your hands down out of the air after you done scrub your fingernails and scrub your hands and let that water drip down to your elbow. If you touch anything after that, you got to do it all over again. So I'm here this morning to tell you to scrub in and prepare. As we embark upon this surgery, as we embark upon the OR, the operating room, and as we start to prepare our minds and our hearts to help the mind of the people shift into a new dimension, into a new vibration, into a new aura, into a new frequency, we're going to have to do it and do it the appropriate way. We're going to have to scrub in properly. Ooh-wee. And so as we scrub, it's an hour and 19 seconds. As we stretch our minds, as we prepare the process of teaching our brain a new way of thinking, as we stretch our minds, and as we scrub in, and as we use this procedure that involves washing our hands and forearms, and putting on a sterile gown, and putting on a sterile gloves that reduce the risk of contamination. That's the whole purpose of us scrubbing in, that we're going to try to reduce the risk of contamination and infections doing surgery. All members of the surgical team should scrub in before the operation. And so I'm here this morning to prepare you and to prepare your mind and your thoughts and tell you that we all got to scrub in. Ooh-wee. As we stretch, we better scrub. As we stretch our minds, we got to scrub in and prepare. That way there's no contaminations. That way that there's no infections. And all members of the surgery team have to scrub in before operating. And so I am here. I came with my assignment already. Y'all see I got my scrubs on. I even throw my stethoscope around my neck because sometimes we might have to put our stethoscope on this thing called life in order to hear the irregular heartbeat of this nation. Because this nation have an irregular heartbeat. We don't know how close we are to stroking out. It's a whole stroke might be on the way. We don't know. It's a whole heart attack might be on the way. We don't know where it is. We don't know where the embolism is, ma'am. We don't know where the aneurysm is. There's an aneurysm might be in the heart of this nation. There might be an aneurysm in the mind of this nation. It's about to explode. We don't know. All we know is it's time to prepare. Ooh-wee. It's time to prepare and scrub in. We got to stretch our minds and then scrub on in to prepare for what's getting ready to happen. I'm here this morning. My assignment is over. I got my scrubs on, y'all. All right, let's do it. We might as well do it. We're going to do it. If we're going to get to it, we might as well do it. Hey, you heard me? I said, if we're going to do it, we might as well go ahead on and get to it. How about that? And so I am Kendrick B. Davis, Sr. I am your thought-provoking specialist. I'm your health-conscious coach and your intellectual content creator. I'm also your podcast professor. And I'm here this morning to tell everybody under the sound of my voice to scrub on in and prepare the way for surgery. Prepare the way as we move into the operating room. to help the mind of the people and to lessen the contamination and the infections that can happen when you come off the street and act like you're finna go straight into surgery. The devil is a lie. You ain't gonna have the ability to do that up and through here. But anyway, that's neither here nor there. I'm just here this morning to tell you, welcome to the Hourglass Era, where the sands of time converge in the morning, Monday through Thursday, within the 9 o'clock hour. I am Kendrick B. Davis, Sr., your thought-provoking specialist, and I'm on assignment. Allow us to guide as we delve into the depths of our consciousness and navigate the interwoven pathways of the mind. Join me on this thought-provoking journey where we explore the spiritual, intellectual, and physical realms, peering into the very essence of health awareness and holistic understandings. Everything on this earth is symbolic of the hourglass concepts, and its narratives and its center represents neutrality, a balance, a pivotal metaphor for our journey. Just as the pH transition from acidity to alkalinity, so too must we navigate our thoughts from discordance to harmony. It's about transversing the realms of the 7 chakras and unlocking the spiritual experiences and aligning our conscious selves with the greater aspect of life. Each session unravels the unexplored conscious thoughts of human existence, inviting you to awaken, transcend, and comprehend the vast expansions of our inner world. So come, tune in, and let's embark together on this extraordinary odyssey towards enlightenment. So we're going to stretch our minds and we're going to scrub in as we prepare for the OR. Y'all be blessed. I am Kendrick B. Davis, Sr., your thought-provoking specialist, and I'm on assignment. Y'all be good.